Good morning, guys. This morning or this afternoon, I have discussion A for you. We are discussing modern tech enabled transitional care for seniors. So, with that being said, let's get going on the show for this afternoon. Here we go. The headline signals a shift toward modern tech enabled transitional care where the vulnerable handoff from hospital to home is no longer treated as an afterthought, but as a critical clinical phase. The article frames this transition as a place where preventable harm, readmissions, and caregiver distress often orientate, and where coordinated technology plus personalized home care models can finally close long standing gaps. It positions transitional care not just as a logistical process, but as a strategic opportunity to improve safety. Continuity and patient experience. Core components described on the page. HomeWatch Connect, a remote monitoring ecosystem using environmental sensors to track temperature, humidity, and other home conditions that can influence recovery. It's, it also supports virtual visits, enabling clinicians, caregivers, and families to stay aligned in real time. This turns the home into a observable care environment. Reducing the blind spots about reducing the blind spots that typically follow discharge. Okay, guys, if you transition somebody from the hospital to their home, um, you have to make sure when they leave the hospital that they have everything in place so they can transition with no bumps, no not forgetting things, not not leaving things behind at the hospital, making sure that they have the correct the correct medications, the correct walkers, wheelchairs, things that they need to get around, things that yeah, also have to make sure the home is ready for them. Let ramps, grab bars, things of that nature. Maybe a call system for emergencies. You have to make sure those are in place also. Okay, total care solutions, a six-tiered care model that ranges from minimal support to highly specialized care. Each level active, wellness, personal, transition, care on demand, specialized, is designed to match the intensity of services to the patient's evolving needs. This modularity allows care teams to scale support up or down as recovery progresses. Together, these tools create a hybrid model, continuous digital oversight paired with human delivered personalized care. Why this matters for hospitals and health systems: early risk detection, environmental instability, heat, cold, humidity, or unsafe conditions can worsen chronic disease or impede healing. Real time monitoring surfaces these risks before they escalate. Giving clinicians a chance to intervene early before better care continuity. Transitional care often often fails because information doesn't flow virtually. Virtual visits and shared dashboards keep hospital teams, home care providers, and families on the same page, reducing fragmentation that leads to medication errors, falls, or missed symptoms. Reduced resources optimization. A tiered model prevents overservicing low risk patients and underservicing high risk ones. This precision helps systems manage staffing, reduce unnecessary utilization, and improve outcomes without inflating costs. Stronger patient and family confidence, knowing that someone is watching not just episodically but continuously, reduces anxiety and supports smoother recovery. Practical practical implementation considerations. Integration with discharge workflows. Transitional care only works when it's embedded into the discharge process, not bottled on the or not bottled on afterward. That means aligning EHR workflows, referral pathways, and discharge education with monitoring and care level selection. Data governance and alert pathways. Teams must define what triggers an alert, who receives it, and what the expected response time is. Without clear governance, monitoring can overwhelm staff or create reliability gaps. Training and engagement. Patients and caregivers need simple confidence building, onboarding, how sensors work, what virtual visits look like, and what to expect from each care level. Adoption hinges on clarity and trust. Equity and access. Not all homes have stable internet, safe environments, or tech comfortable caregivers. Programs must include alternatives and support for those with limited digital access. Metrics and risk to track. Key metrics: 30-day admission rates, time to first post discharge contacts, number and type of proactive interventions triggered by monitoring, patient and caregiver satisfaction, total post acute care cost per episode, staff workload, and alert response times. Risks: false positives, or excessive alerts that create noise rather than insight. Privacy concerns around in-home monitoring, uneven adoption among patients with limited digital literacy, over-reliance on technology without adequate human follow-through, fragmentation in hospital and home care teams don't share a unified communication channel. These metrics help leaders distinguish between technology deployed and technology that actually improves outcomes. Strategic implications for health systems leaders. The model reframes transitional care as continuous data supported recovery arc, not a discharge event. It aligns with broader system priorities, reducing avoidable utilization, improving patient experience, and strengthening value-based care performance. It also positions. Okay, guys, that is A for you. I'll be back on later for the rest of the shows tonight. Later on. So I will see everybody later tonight for the rest of today's shows. For now, Gator Wellness. Take care, folks.